Good afternoon, everyone. I'll just wait a couple more seconds for people to join, and then we'll get started. Okay, super. Thank you, everyone, for joining. We've got a really interesting discussion coming up. All the panelists are very experienced and really friendly people, so it should be a really nice hour to chat through some of the issues in rural care and how connectivity can improve them. As a bit of an introduction to Future Care Capital, we're a charity and a think tank, and we operate in a few different areas. So first and foremost, we've done research and run projects in data in health and social care. But over time, we're developing our work, and earlier this year, launched our technology strategy and are starting to work on innovation projects as well. And our aims are to improve health and social care for all of our beneficiaries, which is everyone in the UK in receipt of care. We work with government, industry, and academic partners, and we're always looking for new people to work with us. So if you want to get in touch, please do after the session, and we'd be interested to hear from you. I'm just going to make a few introductions. So you can see on screen now, we have a really great panel here. So Liz Jones from NCF is their policy director, who I've been working with on a couple of innovation pilots that we're running at the moment. Tony Scales is head of programs for 5G at DCMS. So he'll be able to give some really good insights into some of the programs that have been going already. Anne Williams is responsible for commissioning and contracts at Liverpool City Council, and has been instrumental in running the 5G testbed there, which has been specific to health and care. And then Colin Wood is from rural Dorset, and he's their 5G program manager, and also has a background in NHS and care. So should be able to give some really good insights. So just to start off, I'm going to hand over to each of our panelists, and they're going to tell us a little bit about themselves in slightly more detail and some of their interests in the area. So first on the list is Liz. So shall I hand over to you so you can say why this is important to you?
Yeah. Thanks, Peter. Great to be here. Thank you very much for inviting us. And great to be with the other panelists who I'm sure probably know rather more about 5G than I do, whereas I can bring the perspective of what some of the customers of 5G might be looking for. So I'm Liz Jones. I'm the Policy Director at the National Care Forum. We're the voice of the not-for-profit sector. We're a membership organisation for not-for-profit care and support providers. And our members provide quite a wide range of different services, from care homes for older people, dementia specialist type settings, home care, extra care, services for people with learning disabilities and autism, supported living, and quite a wide range of community-based services. So I'm keen that in the discussion today, we think about the whole of the care sector. Often people use care sector as shorthand for thinking about care homes, but obviously in this discussion, we want to think about all those different types of services that are out there trying to make people's lives better. And that it can actually make the connectivity discussion even more of a challenge. And one of the reasons that I'm really pleased to be here is that for a number of years now, the National Care Forum's had a real interest in supporting the sector in the digital space, helping our members to think about how they can become more innovative in their use of technology for improving the quality of care that they provide, and we've been listening throughout that time to some of the difficulties that they are experiencing around that connectivity, that digital infrastructure, which is so essential for a lot of the advances that we'd like to see. So I guess I'm flying the flag for the wider care sector and doing things a bit differently. Thank you.
Thank you, Liz. That was a really good introduction. And just to say, if anyone has any questions throughout the discussion, please do pop them in the attendee question box. Should we move over to Tony now? Oh, Tony, I think you're on mute.
Caught out at the first. Thanks, Peter. And good to meet the other panelists, and very excited about the discussion today. I think it's a really important one. I run the development side of the 5G testbeds and trials program in DCMS. So I'm an industry veteran, I guess. I've had 30 odd years of working in the communications and technology industries. And I think that we've got no better illustration than the last few months of the COVID crisis to illustrate just how important it is that we remain digitally connected, and just how many services have flipped, and the way that we consume education, care, and we do our work now is more and more through these kinds of events through screens than it's ever been. My personal experience, I suppose, comes back to my mum, who was a district nurse, and when I was a teenager, going out occasionally with her to some of her visits, some of those to care homes, a lot of them to people's homes to go and see her delivering care, and helping her to keep records and things sometimes, which were paper records. So something printed off at the beginning of the week that she would then go and have a series of phone calls from the local phone box to find out what was happening the next day. And then during the course of the day, having her schedule have to be rethought when something went wrong, whether that was drugs hadn't arrived, roadblocks, or somebody's been taken to hospital who was due to be visited at home. So again, a lot of phone boxes, occasionally using phones that people had around, but there were no mobile phones in those days. So wind forward to 2020, and we're now more likely to have, or this year we're just as likely to have a visit from a carer or a medical professional over the wires or over the wireless as we are doing anything else. And I just think it's very important that we do that well. So digital infrastructure has so far stood up well to the crisis, and we've been able to keep on going. And I think that it has changed a lot about the way that we think about it and about how the services are delivered. So it's clearly a massively important facet of our society, our economy, and the way that we relate to each other as humans. So that's why I think it's important to talk about it.
Thank you, Tony, and I learned something new about you today. That's good. And yeah, it sounds like there's a lot of shared ideas here. So I'll hand over to Anne, who's had a lot of experience in this domain already. So if you could speak a little bit about that would be fantastic.
Yeah, I'm just trying to unmute then. Yes, my name's Anne Williams, and I'm a commissioner in adult social services in Liverpool. And about 3 or 4 years ago, I became very concerned when I realised what the impact would have on our telecare services for when the analogue telephone lines get switched off at the end of 2025. And so I started on a quest of trying to find cost-effective ways that we could carry on working in the digital space that didn't involve, because as an authority, money is very tight, as it is with all authorities now. And whilst the title of this event is Rural Affairs, and obviously we're not rural at all in Liverpool, we're still working with people who have the same problems, who face the same issues, and whilst we may face a higher number of people in poverty as opposed to Dorset, people are still the same, and they still face the same issues as they age. People with learning disabilities, autism, face the same issues. So we wanted to try and find new ways of actually getting technology into people's houses, and we were aware that the connectivity issue was going to widen socioeconomic divisions, and we now are all very familiar with the phrases of digital poverty, and we're very well aware of that. So we've been very successful in gaining some money from DCMS in the 5G Create. We were a phase 1 pilot for health and social care, and we're now using some cellular nodes as well into our mesh network, which we've got around one of the poorest wards in our city. And although that we face slightly different problems in that I know some of the communities you want to support don't actually have any access to any digital, because there's not economically viable for any of the big guys to come and put in decent connectivity into the smaller villages and hamlets around the area. We don't face that directly, but what we do have in an urban area is connectivity that's available at maybe £25 per month, that people just cannot afford, because they can't afford to feed their family, they can't afford to pay the rent. And so the last thing that they're going to do is to pay for a broadband contract and for connectivity. So we're widening this time through 5G Create also to add in education as well, so that we can try and make sure that the many thousands of children that haven't had any education during the lockdown can actually try and at least catch up via, there's all sorts of schemes to go on to help people catch up, but they all rely on good connectivity, which is probably a bit ironic, because that's the reason why people have fallen behind, because they didn't have that connectivity in the first place. So they're the sort of issues that I feel quite passionate about, and we're trying to overcome, and look forward to trying to work with Dorset so that we can share our experience and learn from what you're doing over there as well.
Thank you, Anne. And I think that leads nicely on to Colin, who's working in Dorset. So do you want to introduce your interests, Colin?
Yeah, thank you. Colin Wood. I work in the digital place team at Dorset Council. Dorset Council is the rural bit of Dorset, so everything excluding Bournemouth, Poole and Christchurch. We have a set of significant challenges. So we have the most elderly population of any UK unitary authority. That brings challenges, not least budgetary challenges. So 53% of our total council budget goes on protecting the most vulnerable members of our community. And that situation obviously is getting worse with people living longer and more people wanting to retire to areas such as Dorset to see out their days in what's perceived to be a wealthy and pleasant area. We do have some significant challenges. Weymouth and Portland is part of rural Dorset, believe it or not. So some of the most deprived wards in the UK. So we do suffer from pockets of deprivation. But I think it's fair to say that we don't suffer the same level of deprivation as Liverpool. But as Anne said, the challenges are the same. People are in pockets digitally excluded. We have significant connectivity challenges, so both physical and digital. We don't have any motorways in Dorset, so getting around can take a long time, which makes digital connectivity all the more important. So my job is to oversee any work that the council does to try and influence digital wireless connectivity. And we were recently awarded £4.3 million by DCMS to run a research and development programme that's called 5G Rural Dorset. It's mainly focused around farming, rural business and coastal safety. But essentially, we're looking to show how 5G connectivity can be provided in different ways in rural contexts, and if and when it's provided, how rural communities will use that 5G connectivity. So really trying to make the case for deploying 5G differently and helping to come up with the blueprint for 5G connectivity in rural areas. We didn't have a significant proportion of health and social care use cases in our bid, but as I've set out, really, that is our biggest challenge as a council. And going forward, we would like to work with people like Liverpool, who have done a lot of work in this area, and show how rural areas could use 5G to help keep people in their own homes longer, stop them getting into need of acute care. And that's really my interest in being on the panel today. So happy to be here. Thank you.
Lovely, thank you. Very, very good introductions, and I think we get a real sense of everyone's motivation in this space. Something that came up a few times in those introductions is this idea of a progression and education around connectivity and what it can be used for. And I guess in applying 5G and getting people to adopt it and adopt different solutions, you need to be able to very clearly communicate its benefits and also what that means outside of a technical sense, and how that really can benefit people on the ground. So I think maybe, Anne, it would be really good to hear from you about how you've been doing that through your trial.
Yes, it was a health and social care trial specifically. So we work with the NHS. In the phase 1 phase, we worked with our large teaching hospital. And we realised quite soon that actually the benefit of the connectivity is not to get the hospital particularly linked into 5G, but so that their doctors could talk to people in the community. So we needed the 5G connectivity in the community. And because that's where support is required. So this time round, we're working with the CCG and our community health trust, which is called Merseycare, and we're working to make sure that the new technologies are offered to everybody. There's quite a lot now in the health sector which is requiring support and needs again good connectivity, and 5G really provides that because of the low latency, etc. And what we've found is that with the social care, the use cases and the technologies that we introduced help support people. We've got one care home, this is, excuse me, that is actually connected to 5G and has been through the pandemic. And we found that the use of data that they had, particularly in entertaining and keeping people connected with their wider family, was they were using quite a lot of data, which an average contractor, they would have used a month's data in a week. So as a care home with facing financial issues, they found that very, very useful. We've got new technologies in supported living accommodation settings, and again, they're finding it very, very useful, as well as individuals who've got new technologies in their home. And I would encourage people to go onto the Liverpool 5G website, and there's some series of little videos of showing some of the use cases and some of the people who are using the technology and how they benefit from it. And I think those benefits are the community that we assist are very appreciative of. Excuse me. This time when you start with a cough, everybody immediately gets twitchy. Sorry. It's not COVID, I hope. So yeah, so we find that the community we serve are really appreciative of it, and we have had some anti-5G campaigns, but we find that the actual community who are benefiting from it, as I say, they are very pleased to receive it, and we have configured the actual technology. So when the technology goes into somebody's home, that all they get done is shown how to use it. They don't have to do anything to it. And as far as they're concerned, it's just opened a world of new technologies, and in some cases wider independence, and which they greatly receive. We also had a loneliness use case And that's been, again, very, very useful for family carers in the especially during the pandemic, where we've used, because 5G uses a network of networks that starts off as a LoRaWAN signal and it goes through, and that's called push to talk, and that's been very effective. Again, in the pandemic, we found it very useful.
Super, thank you. That's really interesting, and I think it leads on to a question to Liz, which would be how are your members approaching connectivity, and do you think there are things there from Anne that you could definitely adopt and start talking to your members about, and what's the general sense from your perspective of how ready people are to adopt these new forms of connectivity? Hello, Liz.
Oh, yes, sorry. I'm just
Okay,
adjusting my call quality. It's that time of day when the entire street seems to go online. So I think what Anne's been talking about is absolutely fascinating. Talking to our members, and particularly over the last few months, that I guess there's a few things I'd like to say. So COVID has driven an acceleration of the uptake of digital tech across the sector, really. For two reasons. One, around that connecting and relationships piece. So helping people to stay in touch with their loved ones, whether that's in care settings or whether that's keeping people connected in the community. And we've all known that that's really important, but this has been an absolute acceleration of it, which I think has moved us on significantly since February or March. And the other motivator has been connecting to health professionals virtually and access to a whole range of online consultations that probably would never have happened virtually. It would have taken a long time to move to that sort of potential. So we've seen a real increase in the interest in different types of technology to support the provision of care and to support that connectivity around the individual. It is still the case that in lots of parts of the country, the connectivity that is essential, the digital infrastructure that needs to underpin that access to a whole range of different digital solutions is still pretty patchy. So we've been working on a project funded by NHS Digital, actually, called the Hubble Project, where we were showcasing different types of technology that some of our members were using. So a couple of those were care settings, and one of those was looking at technology that can go into people's own homes in the community, so passive sensor technology and also wearable tech. And the golden thread running throughout all of it, with, you know, slightly predictable technology, perhaps like electronic care planning, or really quite innovative stuff around acoustic monitoring or circadian lighting. The key thread running throughout it was a real challenge with access to 4G, let alone thinking about 5G, or, you know, reliable, fast enough broadband. So I think anything that can come out of the work that's happening both in Liverpool and in Dorset, which will enable us to think about how to enable that reliable functioning connectivity for the people working in care and the people receiving care and support, that's going to be transformational. And you know, I don't pretend to be a technical expert on what we need to do to make 5G the way to achieve that, but it would, especially if it's affordable, it would be an absolute key pillar in our ambitions, I think, to support people to embrace not just the technology that is now, but to think more innovatively about some of the technology that's on the horizon, And actually, we might be able to kind of, what's the word when you jump over? You know, we might be able to move to some of the next generation technology pretty quickly if we can sort out the connectivity. And I think if, you know, just listening to the description of the district nurse day in the life of some number of years ago, and then you think of all the aspects of providing home care in a rural area, or even in a care setting in a rural area, all the things you need to be able to connect to do a really good job and properly support those people in front of you, all increasingly rely on that connectivity. So if you can crack it, it'll be absolutely amazing. And in the meantime, if we can't, then we need to think about how to advise people to make the most of what we've got, because we don't want to see that lack of connectivity as a barrier to investment and the potential innovation that can really improve the way that we offer care and support wrapped around the individuals that we work with.
Absolutely, and there's I think a leapfrogging was maybe the jumping over.
The word, yeah.
But no, I think there's some fascinating use cases there that we've not actually spoken about together before. So that's really interesting. Tony, you've said to me a few times in the past that you think that pilots and initial demonstrations and different use cases are always great, but there's often a difficulty in getting longevity out of them and making sure that things persist. Have you got some thoughts about how you can take, say, the different people we've got here and their insights and really make sure that things keep progressing for the future?
Yeah. So just a word on the program first. 5G testbeds and trials came out of a £200 million investment by the government into what was called the National Productivity Infrastructure Fund or Investment Fund, and 200 million that was out of a £1 billion fund, and 200 million of which was reserved for 5G specifically. And we were tasked with building the business case for 5G, fostering the UK ecosystem, which is what all these kind of events are about, and leading the R&D effort. So to that end, we have now, or by the time we get just the other side of Christmas, we'll have something like 30 projects running across different sectors of the economy and across all parts of the UK. And in amongst them, there are multiple health and care use cases being trialled, led by the two we've got here. So Liverpool 5G and the rural Dorset testbeds are probably our best examples of those. But we do have work also going across the West Midlands, and the West Midlands 5G team are also looking to link those things up. And I think that's one of the most important things is what we're doing here, which is linking up the different initiatives so that we get better value, we get more cohesion, and we get more investment coming together into a pot which becomes more viable. We also asked all of our trialists, and it's a standard competition question, if you like, is how will you ensure the sustainability of your testbed once the DCMS funding is gone? And we get a range of sometimes quite creative answers to that question, and others which are a bit more prosaic. But actually, we've seen several of our testbeds which have already moved on from their initial lives to growing into either next stage testbeds like Liverpool, or like Millbrook, for instance, the Auto Air project there, which has now created a business out of the testbed that we started with. 5G is complicated, as I think Anne has already become quite versed in talking about the technology. So when she talks about a het net, I'm sure she loses most of the audience. So I'm going to try and avoid doing that, but it is complicated. And I think what's great about it is that it's configurable. and it's also, it's not the same wherever you go. So I think that people get very confused about, are we going to have small cell millimeter wave across the whole country? The answer is no. We'll only need that where we've got very dense populations trying to do a lot of very high intensity activity at the same time. But one of the great things is we can move, the mobile operators will be able to move capacity around where it's needed, because we'll move from being an industry which is all about the hardware and all about hardware with a small number of companies' badges on it, to being a much more diverse industry where much of that hardware moves to the cloud, and it becomes software configured, software defined. We're also going to get a lot more new applications coming out of this, and I think you've already talked about, or Anne and Liz have also both already talked about, a number of different possible applications where we're looking at high definition video, high definition scans being transmitted across the network from people's homes in a secure and useful way, which means more immediate care can be given. Decisions could be made in the care home or in the home about whether to transport somebody to hospital or not. And that's a key aspect of care, is where the cost goes up, because the default is we'll take somebody to hospital where we know they'll get the best care. Well, what if they don't need that care? What if it isn't a fracture, but it's a bruise which, with a bit of pain relief and a bit of TLC, can be managed at home? That's a far better outcome. There's less congestion, less pollution, less petrol being used, less time for the professionals involved doing traveling, and more time for them caring. So I think those are the sorts of things that we start to see happening. Now, as I said, we asked for all of our trialists to have a sustainability map, or a roadmap to where they will become self-sustaining, and indeed will launch the projects. They'll launch the products and services that they've developed in the trials. That's crucial to us, and that's why there's also an event series around the program, which UK 5G, our sister organisation, have supported as well, which is called 5G Realised. It's all about getting these services off the test rig, off the bench, and into real use. That's when they'll have the big impact on the economy. So that's where we're trying to encourage people to think about not just the R&D and the pilot, but actually what's next. Where's the business case? Where are you going to get the investment from? How can we help you to find that?
I think that's a really good point. I've just noticed that actually Liz has popped a question, so it's a discussion. Liz, why don't you just throw it out for discussion?
So that point about being configurable and much more flexible is really interesting, along with the discussion, the points that Anne made about affordability. So could we realistically envisage a scenario where, for example, within a 5G network, we could have a kind of health and care channel, or specifically a social care channel? So that would be the prioritization for traffic across that community in that area, that would potentially solve some of the issues that come around with the use of data and the pricing of all of that at the moment. Can we start to conceive our own kind of mini social care comms network? Data
yes.
network.
Yes is the simple answer. I think firstly, because 5G and even 4G now enables what's called network slicing, which is absolutely able to support that kind of service. And in fact, we've already got a prototype out there called the Emergency Services Network, which I'm sure you're probably already aware of, which is a 4G or an LTE network already out in rural areas. And that is a network slice already, which is prioritized for the use of emergency services vehicles in the wider parts of the UK. And that sits alongside other initiatives like the Shared Rural Network and the Gigabit program, which both prioritise coverage in rural areas. So whereas the natural instinct of the market is probably to provide the richer areas first, government's working hard to try and level up that by prioritising areas which would normally be last in the queue for both gigabit fibre and for the shared rural network access to mobile networks as well.
I think that's a really good point. And Colin, there's a lot here that Dorset can kind of capitalise on. What sort of plans do you have going forwards to start addressing some of these issues in a Dorset in a rural environment?
Yeah, so as I said earlier, health and social care is a very minor part of our current project. So going forwards, we'd love to work with people who are probably further ahead than we are in this sphere. I think where we can add value is twofold, really. One is providing a rural counterpoint to some of the work that's been going on in urban areas, because rural does bring different kinds of challenges, although some of them are similar. And the other one is really around bringing the model that we're developing in Dorset is low cost deployment of the fibre that's ultimately needed to provide 5G networks. We're working with a partner, Wessex Internet, who can deploy fibre at 1/10 of the cost of Openreach. They have about 1,600 kilometres of fibre in the ground currently, and if we can bring deployment of 5G down, the cost of deployment down to a point where local authorities can afford to invest in that technology themselves, and provide 5G networks, private 5G networks, to provide services that are required in social care, but also in environmental monitoring and other use cases. We think that's really, really exciting, and we think that's where the future of 5G could be for an area like Dorset. So can we provide a network that is affordable and useful to local communities for a number of different uses, which are stacked on top of each other, and change the commercials around 5G deployment? That's what we'd like to do.
Excellent. And some of those uses are going to be.
We're doing in Liverpool. So that's what we're doing in Liverpool. So it's a consortium between the local NHS bodies, the local council, and a couple of we've got 2 universities involved as well. And we're looking to set up a company that will run the network solely for the use of public sector. So, and that's one of the big advantages of 5G, is that it's relatively easy to have a private independent network, so that we will use it just for the benefit of our own citizens.
I think Tony put a hand up.
I did, yeah. There's some pretty long-standing and strong precedents for that approach as well. In Stockholm, for instance, which is one of the icons of smart city life everywhere, I think they've been running a city-owned fibre network that's citywide for quite a number of years now. And on that, they've built pretty much, or a large amount of their social care and their education and their healthcare, as well as environmental monitoring and so on. So there is a pretty strong precedent for that kind of approach, and we're interested to see what kinds of business models might support that kind of operation. The one thing I probably know is it isn't going to be the same answer everywhere. It's going to vary according to geography, according to affordability, and according to need.
So it sounds like there's lots of different players involved in terms of the business case that you need to make. Oh, Liz, did you pop your hand?
So you see, the great thing about coming on webinars where there's people who know a lot more than you do about technical topics is that you find out things you never knew. So that's fascinating. And I'm just thinking now, because some of the work that we've been doing in this in our Hubble project was really trying to to inspire the sector. So working with the sector, showing examples of existing services and providers in the sector who've embraced technology and the impact that it's really had on the people that they're offering care and support to, but also the workforce. Actually, it's been great to hear the different voices explaining what a difference having access, good, reliable access to that technology has made. And I think we've been looking at what are the obstacles for people to think about investing in tech. We've talked about connectivity. There's also that challenge of kind of knowing whether a particular form of technology is going to have legs, if it's going to be sustainable or not. And I guess thinking about the potential that Tony's outlined, just the vision that we could have, the Dorset example of affordable fibre and the Liverpool example of connectivity for the benefit of your communities. If we could take away some of the kind of investment uncertainty, I think people would move more quickly to think about how they can deploy technology across what they do, whether it's in a rural setting or an urban setting, whether it's just for the provision of the care and support that they're bringing, or whether it's thinking about how that benefits the people receiving those services as well as the staff providing it. So I guess the question really is, what if we were to try and make the case for some more investment that wasn't pilotitis, and that kind of thought about that investment in tandem with these developments? What would be the answer? How could we support the sector to make that leapfrogging that we talked about earlier? What would you need? What would you all need?
Who wants to go first? Tony?
Well, I can talk about the practicalities, I guess, a little bit of the network deployment, and work that's going on again within and across government to make that simpler. So the first bit is how do you make the business case fly, and I think you've got to as Colin indicated, and I think Anne has also talked about, you've got to get to the lowest cost possible for deployment, and that means you've got to attack the planning, you've got to attack the physically where the infrastructure is going to lie, how it's going to be connected up in the backhaul and the fibre, how you're going to enable collaboration between fixed and mobile operators to work nicely together, how you're going to reduce the cost of planning, and getting permissions out of from the local authority. And these are things which, mostly, since these services are being deployed by local authorities to a large extent, they're in their gift. And it's one of the big things we've learned from the West Midlands is that by the 7 councils across the West Midlands working together as a combined authority, with respect to planning and access, and with respect to digital assets and understanding where they all are, and forming one voice to talk to the industry, that's made an enormous difference to how willing the industry is to invest in them. So that's the first sort of stage. The second bit is, I think all of you have talked about the same thing already, is aggregating demand. So if you can ensure that a local authority comes forward with a portfolio of services, and that the digital infrastructure has to support, and prosecutes the procurement of that through, again, a simplified process, that again makes it very much more attractive to investors to come in and put their money behind what you're trying to do. Next bit is about communication and understanding. I think that there's an enormous gap between people's understanding of what 5G is for real and how it can be used, and what the sort of marketing messages are from the industry about it. And I think we've got to correct that. We've also got to counter the other issues of misinformation about health challenges from electromagnetic radiation, and just the physical infrastructure on the streets. And yeah, Anne's talked again about that in Liverpool, about how they went about the sort of information campaign. I think the more good news stories you can have of of end users enjoying a better life because of 5G is where we have to get to, and stop the conversation about people who need tin hats on to avoid their brains being fried. Now that clearly is something which Public Health England and other agencies working hard to help counter, but it's local authorities will have a big responsibility in that. The last bit is about how do local authorities prepare themselves to consume the new tech and make best use of it, because a lot of local authorities are financially challenged, and they enjoy a large legacy of technology, and not only technology but also old processes and ways of doing things, which need to be changed to take best advantage of all of this. And working with people like our colleagues in MHCLG, who have really promoted digital transformation. They fund stuff through town and city funds and regional funds for economic development, but those are also available to help local authorities to choose new systems and processes to get to things which are more interoperable, more sustainable, more with a better life, that will then sit on top of the new infrastructure so that you can serve citizens in a more joined up, lower cost, more productive way.
Thank you. Does anyone else want to come in on Liz's point there? In which case, I'll pop a question. Oh, Anne, go for it.
All right. Yeah, I think one of the things that I would welcome is spectrum, and I've been lobbying and would welcome support in lobbying for. I'm sorry, Tony, that we shouldn't be mentioning this with you in front of you. For spectrum for health and social care, military and security have their own spectrum. And I think that is ultimately one of the issues that all of the private networks for local authorities will face, is accessing spectrum. So that's what I would on my wish list.
Maybe you'll get it for Christmas, Anne. Colin, I had a question for you about how you see the difficulties between urban and rural areas. So I guess some people could say that rural care is urban care, but just spread out more. But that's not always the case, really. There's a few other challenges involved on there. So do you want to tell us a bit about those and how you could maybe address them?
Yeah, I guess some people could be quite cynical about the idea that living in a rural area is challenging. People move to Dorset because of its character. It's beautiful, and but loneliness is loneliness, and if you live in an urban setting and you're lonely, it's a very different kind of loneliness, I suspect, to living on a farm in the middle of nowhere and not seeing anyone from one week to the next. So that's one aspect of it, I think. I think one thing that we're perhaps missing here is the digital skills challenge. So connectivity clearly is a challenge, and that has to be there for people to be able to do the things that we want people to be able to do and keep them in their homes longer, leading independent and high quality lives. I think one of the main challenges around social care and delivery of in whatever way, whether that's 5G or other ways, is the support that people are going to need to use the technology that's being provided. We've got a network of about 100 digital champions who work in rural Dorset, who go into, they provide training for people in basic digital skills. And we were just about to launch an outreach service when COVID hit, going into people's homes and support them in their own homes. So we've had to put that one on hold. But hopefully in the new year, once we get back to whatever normal will look like, we can kind of restart that program as well. So what I'm saying is, in a rural setting, even providing the support that people need to access the kinds of services we're talking about is more of a challenge, because they're more spread out across a very wide area. Getting somebody to a library, for example, to have a digital skills session, they might have to drive, even if they do drive, might have to drive 45 minutes to get there, so yeah, it's almost, the challenge is magnified in a rural setting, I would say. Again, one thing, I saw a question pop up from Ian on the attendee questions around are we missing an opportunity here? I think I've interpreted the question correctly. Yes, we do have some wealthy people in Dorset who are elderly and want to live here for all the reasons that we know. If we can provide a better quality of service using 5G, that could become a commercial opportunity for a local authority like Dorset. People want to live fulfilled lives, even into old age, and if we can provide them with opportunities to do that using 5G, there could be something here that helps not solve but contributes towards this budget dilemma that we're all facing. So that's just another aspect of it, really, I think.
Excellent, thank you, Colin, and thank you for feeding that question in. I've been slotting themes from the questions into the discussion generally, so that's useful. One question that has come up that I think is quite good to address is how would you describe spectrum to someone who's looking to adopt the technology? And any one of you is welcome to take this one.
I can have a crack at that one.
Please do.
So spectrum is part of the electromagnetic spectrum, which includes light waves, sound waves, infrared, ultraviolet, and radio waves. And it's the radio wave part of the spectrum that we're interested in for mobile communications. So it's the same stuff that, as I said, connects, allows us to communicate with 3G, 4G, 2G, whatever. Spectrum is electromagnetic spectrum is in a range. It's characterized by where it sits on that range, and 5G has a number of specific spectrum bands allocated to it. It's regulated by Ofcom, so access to it is in the UK is managed by Ofcom independently, and it's also, there are global expectations set around how spectrum will be used. So as Anne indicated, some bodies like military, Department of Defence, etc., have spectrum allocated to them. So do and so do many other bodies. But the mobile operators have to bid for spectrum to use it in their networks, principally in certain bandwidths, which in the case of 5G will sit in three different major areas. One is the sort of narrow band at sort of 700 odd megahertz. There'll be some mid-band at 3.6-ish, 3.4, 3.6, and there'll be a group at the millimeter wave end, more like sort of 2.6 gigahertz, etc. Now, in the middle, though, there's also a very interesting group called which are shared bands, which are 3.8 to 4.2, which are licensable for local use. So those are usable for things like campuses or for local areas. So a local authority could bid, set up a neutral host company or work with a neutral host provider to operate in those bands. Also, the mainstream bands are also potentially locally licensable. And so all the rules have changed around that in a way which is incredibly important for this. And I think that Philip Marnock of Ofcom said that 5G is the first generation at which you don't have to be a major mobile network operator to operate a mobile network. So that's a very important aspect of things. But I think that what Colin said earlier is true. Not everybody has the skills to do it. Not everybody has the experience or the investment available. So I think that there is going to have to be a certain amount of collaboration and clubbing together of ideas, expertise, and operational knowledge to get these things to work as well. Hope that satisfies the need.
That was very comprehensive. The regulator's been mentioned a few times, and I was wondering if Anne, you'd be able to say how your work has been coordinated alongside the regulator, and also on the topic of spectrum, how have you approached all those different bands and roll out it in your area?
Well, as Tony has said, we've been able to access some of the bands, and I think we're in the N77 bands that we're using, just off the top of my head. But the reason why I've sort of said that I think we need health and social care was, as Tony explained, there are all different bits of the spectrum, and it's not helped really in that internationally different countries are using different parts. To me, having been, and I'll say this because my children now grown up, excluded from school from misbehaving in a physics lesson, and not have really understanding the physics behind all of this. To me, I see it as when I dial a radio station, that whatever that bandwidth is that you're listening to, it's just a massive version of that. So it's different bandwidths used on the spectrum. I know it's not really, but in my simple mind, that's the easiest way I see it. But we're struggling to find 5G technologies that we can test and trial that are dedicated for 5G. And I think it would be useful for, certainly in the social care market, if there was a standard spectrum that then the companies that are designing the new next generation of supports and monitoring would know what bandwidth that they have to put into the modems, into their devices. And I think it would also help in the health sector as well. I've had conversations with some of the companies who are looking to develop devices in this area, and one of the reasons why they're not going ahead at the moment is they're not quite sure what spectrum that that's going to sit on. So I think that's one of the reasons why I've asked for, I think it would help everybody, because I take the point that was made earlier about the care organisations are as a commissioner of social care services, they come to me and they say, what digital care record system do you think we should have? And they want to know which they should buy. They're less bothered about what spectrum it is. They need to know how easy it's using, how you can, what training's required for the staff, etc., etc. And they're the main things that they're interested in. We've developed what we call an adoptionist readiness level tool for companies who have got technology. And part of that was to filter out some of the stuff that people try to sell to me. So the most extreme case was a toilet, which was somebody had the franchise to sell the toilets from a Japanese company. Don't know if any of you have been lucky enough to go to Japan, but quite often they have fancy toilets that wash and dry and have paper that comes automatically over the seat, etc., etc. And this company wanted to introduce this into care homes, and were trying to sell me for only £4,000 per toilet one of these toilets. And the unique selling point of it was that it could do a urine pregnancy test. So I felt it was not appropriate in a care home. And in fact, we would have many saints if our elderly people living in a care home found that they were pregnant. But I felt it also missed the mark on understanding the people who are living in care homes, and that unfortunately a lot of them are incontinent, and that can be part of the reason why they're in the care home. So having a toilet for £4,000 is not actually of any benefit to anyone. So I work very closely with an organisation of eHealth Cluster, Rosemary Kay, and between us we've come up with this adoptionist ready level, which lots of companies are finding very useful to understand the sorts of issues. So we're asking them, a lot of the technology companies think things that they will say to me, it was just plug and play. Well, if you try to explain that to a 90-year-old who's living at home by themselves, who takes out the plugs every night before they go to bed, we have to actually work with people to understand what sort of technology they'll accept in their own homes, as well as understanding how it works and what they have to do. And so we've worked very hard to do that, and we've tried to avoid the pilotitis that was mentioned. And the technologies that we had on the first phase are now part of people's care plans and are extended, and we are trying to use it along the way and make sure not all of the technology worked, because that's what a test bed's there for, to see what does and doesn't work. And one of the things I would still like is to have an easy to recognize dehydration model. We did try to do that with some urine samples going through a toilet, but that didn't work. But it's something, because dehydration is one of the real problems that we face, and we would welcome anybody who's out there now who's looking to develop something. We really see that as an issue.
Peter, can I come back across?
We are rapidly running out of time, but I guess it's tricky to get a sense of whether people are hanging around for last minute questions. I mean, go for it, Tony.
Okay, so very quickly, so Anne, you're absolutely right. Access to market ready equipment is challenging because we're still very early in the life of 5G, and those global decisions are still being made. But you are operating in that 3.8 to 4.2 shared spectrum band. So finding a way of accessing that and getting access to that spectrum is something I definitely encourage the dialogue to Ofcom to continue. If necessary, we'll help as much as we can with that. The second thing is access to services that are ready to use and suppliers who are ready to offer services in this area. UK5G.org is the website, and there is a supplier directory on that. So if you know of kit that has been used in your, or services, products have been used in your trials that aren't on there, please encourage them to put them on there, and encourage them to make sure that you are referenceable for your experience of using them.
Excellent, thank you. And there's some good calls to action there. So I'll add a couple of my own. This is an area that we're really interested in working in, and seeing how we can support the care sector and also the health sector. So we'll be developing more in this space going forward. So anyone in the audience interested, please keep an eye out. We've got a newsletter, so please register for that if you're interested, or reach out to me directly. I think my email is online, so if you want to get involved. Or I've just seen the newsletter and inquiries options have popped up on screen. So all that's left to say is thank you very much to all of the panelists. It's been a really interesting discussion. And yeah, I hope to see you all soon, and welcome a lot of the guests back for a future event. So thank you all very much, and see you soon.
Thank you, Peter.
Thank you.
Thank you.
you all.
Bye-bye.
Bye.
Bye.
Bye-bye.